guys, welcome back to our channel Rig Megha. Myself UPASONA Panday. I'm a second professional MBBS student from NILRATAN SIRCAR Medical College and Hospital. This video will be the continued discussion of the venous drainage of the lower limb. If you haven't seen our video on the superficial vein and the deep veins, go to the links below and watch them before you come to watch this perforators. Okay? Now, let us begin our discussion. What are these perforators? These perforators are the veins that connect our deep vein with the superficial veins. In order to communicate this to deep and the superficial veins, they need to cross the deep fascia of our lower limb, and then they also has to cross the intermuscular septum, lie in them, and then finally drain into the deep vein. The direction of blood flow is from the superficial veins to the deep veins. Why? Because these deep veins will ultimately drain the blood to the heart. So the blood has to be directed to the deep veins. Is there any exception? Yes. In our foot, the blood flows from the deep veins to the superficial veins, but ultimately that blood is again directed to the deep veins. Just to maintain the continuity, this happens in our foot. Now let us look into this perforators. Where are this? Now let's go back to our familiar image. There are 4 important perforators. 4 names, actually 6 perforators. Those are very important. What are those? The first one is our mid-hunter perforator. This connects our great saphenous vein with our femoral vein. As from the name we can guess this mid-hunter perforator should be present in our hunter's canal, right? So this is present somewhere in our thigh. Okay. Now the second one is our knee perforator. This knee perforator again connects the great saphenous vein with one of the deep vein. This time this is the posterior tibial vein, which is one of the tributary of the popliteal vein. And this knee perforator, where this is present? Knee. So this should be somewhere present near the knee. Yes. This is present below knee onto the medial side. Right? Now the third one is that this is not a single one. There are 3 medial ankle perforators. This medial ankle perforators again connect the superficial vein, that is the great saphenous vein, with our one of the deep vein. What is this? This is our posterior tibial vein. But this time not with the great saphenous vein directly, to one of the tributary of the great saphenous vein, that is our posterior arch vein. So this posterior arch vein communicates with this posterior tibial vein via these 3 medial ankle perforators. Now fourth one is the lateral ankle perforator, and this connects one of the tributary of the posterior tibial vein, that is our peroneal vein, with the superficial vein, that is this time the small saphenous vein. So let us quickly recap them. First one is our mid-hunter perforator connecting our great saphenous with the femoral. Then our knee perforator that connects again our great saphenous with the posterior tibial. Third one are the medial ankle perforators. Those connect the posterior arch vein, that is one of the tributary of the great saphenous vein, with our posterior tibial vein. And the fourth one is our lateral ankle perforator that connects our small saphenous vein with the peroneal vein. These are our perforators. Now, as this blood flows from the superficial vein to the deep veins, there must be something that prevents the backflow of the blood from the deep to the superficial veins, right? So, there should be the presence of the valves. Now, how many valves are there? There are like 10 to 20 valves all through our lower limb. Among the 20 valves, the most important is the saphenofemoral valve, that is present at the junction of the great saphenous vein and the femoral vein. So this saphenofemoral valve prevents the backflow from this femoral vein to the great saphenous vein, and this one is the most important one. Now there is one more valve that is present at the junction between this external iliac and the femoral vein. This has some clinical correlations that we'll be discussing just after a few minutes. Before that, let us see one of the modification of this perforators. Right? We are all familiar with the calf muscles of our leg, right? The calf muscles, that is the flexors of our leg, that is the muscles that are present in the back of our leg. This calf muscles, especially the soleus muscle, there is one speciality. What is that? Now the perforators at these regions form the venous sinusoids. You see, the sinusoids are formed and the blood flow through this from this superficial to the deep vein, right? Now this contraction of this muscle, the contraction of this calf muscles aids to the squeezing of the blood from this superficial veins to the deep veins. When the calf muscles contract, then what happens? The blood is squeezed. Due to the force of the muscular contraction, the blood is squeezed from the superficial to the deep veins. That is why these calf muscles are called the peripheral heart. Why? Because this aids to the venous return to the heart. Without the active participation of these muscles, it is very hard to drain the blood of the lower limb to our heart. That is what happens when, like a patient that has undergone a surgery and is at bed rest for several days. The blood flow from this lower limb is sluggish. Now what happens? Now there are formation of this deep vein thrombosis. This deep vein thrombosis now tends to go up and are lodged at various arteries and causes various blockage. Like this thrombus starts from the femoral vein, then go to the external iliac, common iliac, inferior vena cava, and ultimately drains into the right atrium. From the right atrium it goes to the right ventricle, and from the right ventricle it goes to the pulmonary artery, and there in the narrow lumen of the pulmonary artery it may get lodged and can cause blockage. It can lead to pulmonary embolism. This is a very common case right at this point because the COVID patient are having the pulmonary embolism. But do they have this because of this deep vein thrombus? No. This COVID has some speciality that it can form the in situ embolism in our pulmonary artery. And that is why the D-dimer test is done. What is this D-dimer? Now these D-dimers are the degraded products of this thrombus that is formed in the pulmonary embolism. That is why for the COVID patient, the D-dimer test should be a must to prevent any further complication of the patient. If the amount of the D-dimer is high, it means that there is formation. There has been formation of this embolism and it needs to be taken care. And you being the medical students should know the medicine for that. It is low molecular weight heparin Clexane. That is the trade name. It can be given like 0.4 ml or 0.6 ml twice a day. Okay. And what is the medicine? The drug is the enoxaparin, right? You should be knowing this during this COVID time. Now let's come back to our topic. That is, we were in our deep vein thrombus. One is the case of pulmonary embolism, and the second one is that somehow if the thrombus escape the pulmonary circulation, there is high chances that it will go and get lodged in our brain vessels, like for example in our internal carotid vessel, and that will cause brain stroke and paralysis will occur. Okay, so we can understand the importance of these calf muscles. Whenever this calf muscles contracts, there is augmentation in our venous return, and that is absolutely important for maintaining the blood flow from our lower limb. Okay, now we are also left with one of our important discussion, that is our varicose vein. What is this varicose vein? Now suppose this valves that prevent the backflow from this deep vein to the superficial vein, this valve become incompetent. That is, the valve is not working properly. There is some valvular damage. Then what will happen? The blood will backflow to the superficial veins, and there the blood will tend to accumulate. Why? Just like the drainage system of India. Especially in the rural areas, what happens? Due to misfunction of this drainage system, in our big drains, the dirty water accumulates and the water level rises up. Same thing happens here, that when the blood is backflown to the superficial veins, the superficial veins, what happens now? This veins tends to swell up because of this misfunction in the drainage system. So what will happen? The superficial veins will swell up and will become tortuous. That will be well visible from outside. Now what will happen? Due to this accumulation of blood at certain regions, some other regions will be deprived of the blood. So those regions will be deprived of oxygen and essential nutrients, and that will result in pigmentation of the skin in those regions. So what are the features of the varicose vein? First one is the tortuous veins. Second one is the pigmented skin. These are two important symptoms that will be seen in our varicose veins. Now we were talking about a valve at the junction of the external iliac and the femoral vein, right? And we said that this valve is having one important clinical correlation. This valve reduces the load, the pressure on this saphenofemoral valve, because if more load is there in this saphenofemoral valve, there can be chances of damage to this saphenofemoral valve that will increase the occurrences of incidences of this varicose vein, right? Now most of the individual is having this valve in the junction of the external iliac and the femoral vein, but few individuals lack this, and obviously they are having higher chances of varicose veins. People who lacks this valve has shown most of the cases of the varicose veins. So we can understand this, we can understand the importance of this valve. Now we don't know, are we having the valve or not? God knows. So we are almost done with this discussion of our venous drainage of the lower limb. Once more, there is a reminder for you. Do not forget to watch the video on the deep vein and the superficial veins, right? And if you are having any problem, feel free to write in the comment section and put a thumbs up. And if you are new here, subscribe to our channel, because your one like and one subscribe will motivate us to make more such amazing videos. Thank you. Tata. Bye bye.